Hi, Shanna.
Hi.
How you doing?
So excited to see you today.
Oh, I am so excited. Congratulations on your baby. He is gorgeous. And you look
Thank you so much.
like your motherhood behooves you. That's amazing. You look
Yes.
prettier than pretty. You have a glow.
Oh, thank you.
So,
Appreciate
Shana,
that.
a lot of people don't know about thermography. We have been doing thermography and seeing patients with thermography for years, and it just never ceases to amaze me. We had a patient this week with thermography, and her entire head and everything was red, and she took action immediately. And the report that we got was phenomenal. Very accurate diagnosis of what she had in her mouth. We could see that she had periodontal disease and TMJ inflammation and all that. So tell me a little bit about the thermography, like if I didn't know anything, so people that are viewing it and listening to us can be educated and go for it.
So from thermography is infrared imaging of your body, where it could be possible cancer detection. It could be detection of issues going on in the mouth, like gum disease, periodontal disease, tooth infection, so it's such a wonderful health analysis for every person, no matter the age. Even my young baby has already had his scan and he's only 6 months old.
Oh my God, I would love to see that. That's amazing. Did he get any red areas?
No, he was thermographically normal. So that's great. And that's actually unusual because most adults have gone through so much in their life that just about all of us have abnormal heat signatures.
Yes. So,
but he hasn't yet, so he's all good.
Oh my God, you're going to be scanning him how often? Like once a month?
At least once a year.
Okay.
At least once a year, but the interpreting doctors in the reports, they write when they want the patient to follow up. So it most common is 6 months because, like I said, most adults have heat signatures that they should monitor. But then the idea is at the 6-month follow-up, things are stable or improved. And that tells us that there probably is not a cancer in the body and there's probably not issues that they really need to look into right away.
So I love to get the thermography, the reports on the patients because it is so accurate. It's like it's like the x-rays, once I see the x-rays or a CT scan, I already know the medical history of the patient. If they have mercury, I know that they're going to have thyroid issues. They're going to be exhausted. They're going to have difficulties concentrating. They're going to have, attention deficit, most probably. And some people even have depression and suicidal thoughts. It's amazing. So yesterday we had a new patient and she had 5 root canals, right? I already knew that they were on the meridian of the large intestine and the lungs. So I already know she's having, digestive issues and sinus issue because she had 2 on the upper, right quadrant on the sinus with abscesses. So it's interesting because if we work together, right, as a team, the thermography, the doctor, and the biological dentist, then we can actually eradicate the focus points and the foci that's causing all these inflammatory responses, being periodontal disease. That's when you see the entire lower red, and you see on the thermography, you see all the limbs here, and everything here is red when they have periodontal disease. And then when they have the TMJ, everything here is red. And sometimes they even have tinnitus when they have the clenching so hard. So tell me a little bit about what's new and what trends are you seeing in terms of when you do the thermography, what are you seeing a lot with, like the patients?
So having to do with oral inflammation, usually I hear of, one way or the other. Either a patient knows about their issues and they feed them back to me and they say, yes, I have this, and this going on. And thank you. This scan is now motivating me to go back to my dentist or look into holistic biological dentistry to really get to the root cause of why I have all this inflammation and work on turning it around. Or they had no idea that there was anything wrong. Their dentist for years has been telling them things are okay, yet they're lit up like a Christmas bulb, So it's so eye-opening to see these reports either for the patient or the doctor, because then it can help you to further convince patients that they need to get this work done and turn this scan around. It's a very powerful visual, I think, especially the rainbow palette, because when they see red, people just have that associated in their mind, red, danger.
Right.
You do not want to have a lot of red and then see it leaking down into the neck, and whether it's the mercury or
the breast, yeah, into the axilla,
and all the way into the breast. Mm-hmm.
Yeah.
It's all connected, right?
Yeah.
Issues in the mouth don't stay in the mouth. And I think thermography can really help patients to understand that visually.
So, how can people find place to do thermography? Is that being challenging? Or, like we need more of you, huh?
Yes.
What are you going to do about this? You got to fix this problem.
Well, we actually have a technician who's starting June 30th in your area. She lives in Plantation. So she's going to be servicing all of our locations in South Florida and possibly even the West Coast. So we go from as far north as Jupiter, all the way down to Miami, and probably about 20 to 25 locations in between. So they would just need to visit our website to get on the schedule. It's flowwell.org. So that's F as in Foxtrot, LOWWELL.org. And you just click on schedule an appointment, and there's 3 you can choose from as an adult. So you could get the full body scan, which shows you what's going on thermographically everywhere in your body. It's great to get that scan as your baseline because you use your whole body every single day. And so you never know what you can see thermographically that you cannot see with the naked eye. Yeah. There's also the health screening, which is the upper half of the body, front and back. So basically the torso, you don't get to see the extremities with that scan, but that one's $349. And both with the health screening and the full body, they get the head, the neck, so it's really important to see those things, especially if a lot of women come to me because they have breast issues. And if that's the case, you want to see what's happening above the breast. Yes. Is there a correlation there to what's going on in the breast?
Yeah. So the technician will go to your location, or is there a physical location that we can go to?
Yeah, she's going to be a traveling technician. So there's various.
I wanted to get, because I want to get my whole body. I'm due. And how would I, I go to the schedule and then I meet her somewhere, or does she come to?
Yeah, we utilize different doctors' offices. So in Fort Lauderdale, we're at Thrive Wellness Center.
And where is that?
And we also it's in downtown Fort Lauderdale. Okay. Just south of downtown, almost to the airport.
Okay. So we got to find that address to give the patients.
Yes.
Because
do you want me to find it now?
Yes, let's be ready. Because you know what? Okay. I so appreciate those reports. I think they're life-saving. I had a patient that came with a young woman. She was in her 30s. And when I saw her thermography, I wanted to cry, because it showed that her breast was totally destroyed. It looked like I have never seen anything like that. So I'm a believer in thermography. I have a traditional OBGYN that wants me to get mammography for years. And I say, I do thermography. She's like, no, that's below standard of care. And I wanted to be respectful to her. I did not tell her radiation is below standard of care. This should be standard of care. But I'm not going to get into a fight with my OBGYN. She's not open, but I will do my thermography and bring it to her, because I think that she lacks the education. And it makes me so sad, because she's forcing all her patients to put their breast and radiate every year. And my mother's one of those. She's 80 And every year she goes, I said, Ma, you don't have breast cancer, but you're going to get it if you go, radiate your breasts every year. So, but, she trusts the traditional doctor. How can you change the mind of somebody that is so they trust the old medical, format, but it's not working,
That's an
we're
excellent
dying.
question. I'm really glad you brought it up. So thermography, the FDA considers thermography an adjunctive screening to anatomical testing.
Mhm.
So thermography is 97% sensitive or accurate for breast cancer detection, which means it's 3% wrong. If you
Mhm.
look up the stats on mammography is 83% sensitive or accurate, which means it's 17% wrong.
Wow.
So both tests are not diagnostic. You shouldn't use either test as a standalone test. And when you get your thermography scan, our interpreting doctors are going to write in there if they want you to go for further imaging,
Mhm.
right away or not, based on your previous history of anatomical imaging.
Mhm.
So the comparative anatomical tests one could get are a mammogram, an ultrasound, or an MRI. And so it's up to the doctor patient team, to decide which tests that they get for their body.
Mhm.
And you're right, mammography has the ionizing radiation that can lead to cancer if you overradiate the body. There's also compression of the breast
Oh,
tissue.
that's the
It's a
worst.
50 pounds of pressure.
It's like
So if there were cancer,
yeah,
yeah.
it's painful.
I've never had one myself, but I've heard that if there was cancer present, you could run the risk of it spreading.
Yeah.
And then there's ultrasound imaging, which is just sound waves. That's totally safe for the body. It unfortunately isn't the standard of care, so sometimes it's a little bit more challenging to request one, but you can do it. You and any patient can absolutely do that.
Right. Awesome. So, I have been looking at thermography for many, many years, and I just love it. I think that is, I really enjoy looking at the reports. They're usually extremely accurate. It is like the patient came and I look at the report, the images and that they email me were, black and white. In this particular patient was from a Boca doctor, but the actual doctor that looked at the stuff, it was right on. Everything that they wrote, it was exactly what I found. The patient got treated immediately, and she left very happy. So tell me about what you see, happening in the future in the world of thermography, to become more standard of care.
Thermography has been around since the 70s for breast cancer detection. And in the US, I don't really see it becoming the standard of care anytime soon. It is offered in other countries. It is covered by insurance in other countries. But here, unfortunately, we're a little bit behind the times as far as preventative medicine goes. And so, I've even heard of an interview before by Dr. Christine Northrup, and she said that thermography is cancer's best kept secret.
Mhm.
It's unfortunate that it's not mainstream. It's not, taught in medical school. So your OBGYN is simply going by what she was taught in medical school, that mammography is a standard of care. And that's what she's required by her license to recommend to her patients. And so she's not, my guess is, doing research outside the box to really learn more about that before educating patients. But
So what you're saying is,
the science is out there.
yeah, no, I agree with you. So from the 1970s, you're talking about 50 years, people, this has been available for 50 years. And
Yes. Just got the
and
chills. A long time, right?
that's a long time. Well, the good thing one thing good about COVID is that people have become more aware of the importance of attacking and getting rid of foci infections, and people are more proactive, trying to get more educated. So that's why we're doing the podcast, because the information is out. It's a matter of people actually reaching out and becoming more educated. And we're on a mission with that, trying to spread the news that are like prevention is the best medicine. So how long have you been in this world? Like, how do you
I've
become
been
a thermography?
Yeah, it's a great question. I've been a thermographer for 10 years now.
Wow.
I started in 2011, and I'm still a professional member of Breast Thermography International. And so ever since I've been a traveling technician, I started in Manhattan and then moved to South Carolina and Florida, and now I'm out in Washington State. But if you wanted to become a thermographer, you have to definitely have a passion for it and holistic health, ideally.
Mm-hmm.
And you would just get trained by PACT. PACT is the Professional Academy of Clinical Thermology,
Mm-hmm.
and they train our thermographers. So that's what I am, a thermal imaging photographer. So I'm a thermographic technician. And there's also our expert thermologists. Those are the doctors who go on to do further training to really learn how to read and compose the thermography reports for patients. So our thermologists are sort of like radiologists in that they already have some type of doctorate degree, and then they go on for further training to become thermologists. And yeah, that PACT website is medicalthermology.org. If anyone wants to learn more about the training, that's where they can learn about it on that website. And just let them know that Shanna referred you there. And because of this podcast, they're interested in training. And we would love to have more thermographers.
Yes.
Even though I'm going to have Jenna in your area, we
Yes.
could benefit from more thermographers. Absolutely.
Yes. So you were saying about the online training. I have a lot of, I like to mentor young people, and I think that getting into the world of medicine and holistic knowledge and caring for your own bodies is a vital, important thing for young people to embrace nowadays. Because if they don't become aware of the foci of infection out there, the air is polluted, the water is contaminated, and also the mind. Your thoughts really have a lot of power. And with all the changes in society, the young people are feeling unstable and a lot of anxiety. They're getting depressed. And I counsel a few young patients that we have. And, perception is reality. So if they perceive that there's danger, then that's a reality. And what I see is that people are running their adrenals are on fight or flight 24/7. So they have adrenal fatigue. Does that show on the thermograph, the adrenals being red?
I would say you can't diagnose that, but you can definitely see inflammation in the body, which could warrant further testing and lead to a diagnosis of adrenal fatigue.
Yeah. So because I'm wondering, how does that look? Because I'm curious, I would like to see thermography from all the patients, because maybe I say after you see, 10, 20, 100, 1,000, you're like, oh, this is the same as that person, that had the mercury and the thyroid is red.
In each one of our reports, if there's areas of inflammation or areas that are too cold, areas that are lacking circulation, our interpreting doctors are going to say clinical correlation is warranted. And then it's up to the patient to get with their doctor or their dentist or any wellness practitioner they work with and do some further testing, or even it could be physical examination. It can be talking, it can be counseling. So there's 5 topics that I cover. I have a full body detox program that I offer. And within these 5 topics, we usually find out what's causing the inflammation. It could be diet, exercise, detoxing, de-stressing, or sleep. And so all of those things cause imbalances in the body. And most of the time, patients already know where their imbalance lies.
Right.
And so then I get to connect them with wonderful doctors like you to really turn their health around and improve the thermography.
Awesome. So once you eradicate, for example, the toxins in the mouth, how often or how soon do you get the second thermography? Like 3 months down the line or 6 months down? Like what is the time frame to get a second thermography?
So after somebody's first scan, the most common recommendation is a 6-month follow-up.
Okay.
And that's because quite often adults have heat signatures that are borderline, where we consider them normal to abnormal. And so in 6 months' time, we want to see, what are they doing? What are those heat signatures doing? Are they increasing significantly? And if that's the case, it could be cancer, or it could be other diseases. Are they stable? Are they staying the same? Or are they decreasing? Which means the patient probably worked hard on their health and we're seeing improvements. And that's what I love to see in 6 months' time, because that typically means that they're going to get a year recommendation for their follow-up, and I'll see them again in a year. If things aren't improving, it could be 3 months, depending on if the heat signatures increase significantly, or it could even be a month. I've seen a month follow-up as well, and that's usually somebody who we know has cancer, and we want to monitor their progress with whatever treatment they're doing.
Excellent, excellent. That is fascinating. I love it. So you're coaching the patient, and then, now with COVID, there's a lot of anxiety. Do you see more inflammation on the brain?
So the brain is too deep within the body to be able to determine anything thermographically. Some other organs are as well, the lungs, the uterus. But, we're all connected. So if there's heat signatures going on the surface of the body, either way, it's going to recommend, a patient to do lifestyle changes so that they can reduce that inflammation, and it helps the whole body, not just the surface, when they do that. But we do offer a carotid artery evaluation. So there's veins on the forehead right here and here. They're called branches of your supraorbital artery.
Okay.
And if one side of the forehead is significantly colder than the other, it could indicate blockage in the corresponding colder side. And if somebody can address that, they might be able to avoid a stroke in the future.
Wow.
So that's huge.
So they can start implementing diets and herbs and things that are going to break down a clot, for example, and exercising.
So one of the most important screenings that we do in the body is the carotid artery evaluation. So you have on the sides of your neck, your carotid arteries that feed the blood supply into your brain. Yes. And the blood travels there through veins that rest on your forehead right here and here. They're called branches of the supraorbital artery. And so our interpreting doctors, they calculate the temperature on each side of the forehead. And if one side of the forehead is significantly colder than the other, it could indicate possible blockage on the colder side in the corresponding carotid artery. Yeah. And if it were early detection, wouldn't somebody want to know about that before a stroke occurred? Right. So they may have time to do something about it before that could happen. Just because they have that variation in the forehead doesn't necessarily mean the carotid arteries are blocked. You can't diagnose with thermography, but wouldn't you want to rule it out if there was that abnormal heat signature? It could also be something like acne, eczema, psoriasis, head injury that's happened in their lifetime. But, it is a good idea to get further testing if that's an abnormal finding.
Yeah, I'm going to call Jenna as soon as we hang up because I'm really curious. What's happening in my body, and just troubleshoot it right away.
Yeah, we can get you scheduled in just a few weeks. Early July, she'll be ready to scan you in Fort Lauderdale.
Yes, okay, definitely, because I'm going to take some days off in July 8th and 9th. So maybe I can
perfect.
Be booked with her, to take care of my health. You got to take care of yourself.
So yes.
Cool. So tell me any other things that you're seeing with the thermography. We're seeing, unfortunately, I had a patient from Seattle, 28-year-old young woman with colon cancer. They caught it in the thermography.
Wow.
And, who has colon cancer at 28?
Oh, that's so sad.
Perfectly healthy, right? And the mother flew her. She had a root canal on the tooth meridian that's connected to her intestine, to the colon. So she flew. We got the mercury out, and we got the root canal out. And she said, Dr. Cintron, the moment you got that tooth out, I felt a healing in my body. So her body is very smart and she's very young. And I just like feel it in my heart that, she's going to be all right. But she had to go through chemo, radiation, and they removed part of her colon. And she had to have one of those bags for a period amount of time while they were able to, remove it. So
Wow.
what an experience for a 28-year-old.
I can't imagine at any age.
Yes, but we're seeing younger and younger people with cancer. We had a patient that had passed away, 33-year-old. And I wish that, when she was younger and all those things, were accessible to her since 1970. So you have to do something about this, Shana.
That's why I'm even scanning my patients' kids for free for our technician service, because
Yeah.
I want to educate parents at a young age. They can benefit from knowing what's happening in their child thermographically. And we're seeing some of the mottling patterns in kids, which they kind of look like leopard spots on the body, and they're indicative of toxic buildup or hormonal imbalance.
Right.
And so if these are present in a child,
Yeah.
that's something that the parents need to know about, because they need to make lifestyle changes for their child through diet, exercise, dressing. All those things play a part in disease developing in the body.
When people buy chicken and it's not organic, these chickens are being injected hormone into the tissues of the chickens, so the breast will develop. So you're finding boys that have developed the breast, they're developed, breasts, and that affects them psychologically, and it's all the hormones in the food. So we have to be mindful if you're going to have any protein and it's going to be animal based, the meat, it's better not to eat it if it's non-organic, because it's full of hormones. And then that is one of the reasons why a lot of young women are getting breast cancer, and the boys are getting all these love handles, from the estrogen, and men are getting love handles, and they're young people, and it's all the hormones, accumulating and having the fat develop around the waist. They exercise, they're doing all the right things, but it's choosing better quality of food. Wouldn't you agree?
Diet is you've heard since you were a child, right? You are what you eat.
Yes.
And if you're eating an animal that's been injected with antibiotics, it's killing all the good and bad bacteria, but definitely the good bacteria that we need. And if they're injected with hormones, that's causing hormone imbalance in us if we're eating that meat. Yeah, so I eat all organically. I eat a ketogenic diet.
Yeah.
You want to do these things for your body to be as healthy as you can and hopefully prevent disease in the future. It's definitely a huge part of optimal health for each person.
Yeah, everything helps. Everything helps. Everything, your thought, your connection to God, your beliefs, the people that surround you, choose people that are loving and kind. Stay away from that. Yeah, people that lift you up and believe in you and have high energy, and they want to be, there's a creative energy. When you are around people that are creative, and God is our creator, so we were made to his image. And when we are being creative, we feel that energy that's given, when you're in the zone is when you're connected to God. You're in the zone. You don't know if it was 5 minutes or 5 hours. So that's when you are in the zone. I love speaking to you because I know that you're passionate about what you do. You're on a mission. You are trying to change the world and bring thermography to be part of standard of care. And I believe that the more we educate people, the more that people are going to request things like this that are non-invasive.
Thank you. Hopefully someday it will be the standard of care.
Yes, absolutely. Well, it's going to be a standard of care for us and our patients. We recommend it. We cannot wait to meet Jenna and be part of the team that, it feeds her patients, so that way we can all have more information that's diagnostic and preventive.
Yeah, me too. I'm so excited.
Yes, thank you so much. And anything that you want to know from us? Anything that you want to share with our clients?
Yeah, I would like to share this podcast on my website. So, can you mentioned you saw a patient from Seattle, and I'm out here in Washington State. So,
Yes,
regardless of where anyone is in the country, it could be beneficial for them to travel to you to get an analysis and have you check out what's going on in their mouth. So, how can my patients contact you if they're not in the area? Do you offer phone consults to, evaluate if it's something they can travel for?
yes.
How would that work?
Well, we have teledentistry and we have done quite a few of that. And I love it because during COVID, I always wanted to do it. We have patients that travel from all over the world. And it's great when, you have a face-to-face because you can feel the energy and see if you're compatible that way. A lot of patients, send us records of what they have. They have CT scans or the last radiographs. They even send us photos of their teeth, and then I have a consult with them, and they fly in. We definitely do all the diagnostics here, and we can give them an idea of what the cost would be to do any particular procedure. If we have to remove a root canal tooth that is abscess, how we reconstruct it. We have a website that's called gonaturaldentistry.com, and they can link and get information and contact us through that, or send us an email at info@drcintron, cintron.com. And we have a lot of the patients fly to get the surgeries, and what we recommend is have the consult. We can speak about the cost, and then they fly in. We are next to the airport, 10 minutes away. There's a hotel and Marriott across the street that they can literally walk. And they fly in, we take care of them. They stay in the hotel, we see them the next day. And we help them coordinate everything because, it could be frightening. But Fort Lauderdale is a great city. People come here on vacation all the time. It's beautiful. We're by the ocean. So it's a win-win. They can do a medical vacation.
I
And a
love
lot of
that.
people do, it's they want to run away from the winter, and they come. And it's very reasonable during the summer also. So we have people flying from all countries, Europe, Germany, Switzerland, Spain, Portugal, South America. We have patients that are medically compromised, stage 4 cancer. We have people with sinus problems that can't breathe. We have people that have neurological conditions, MS, Parkinson, autoimmune disease, thyroid issues, Hashimoto's. And it's wonderful to be part of the journey and see the patient the next day after surgery, and they say, I feel different. I feel better. A load has been taken off me. So biological dentistry is real. We're extremely passionate about what we do because it's really cool to be part of the healing process of somebody. You do not know this person, and suddenly you're part of their journey of wellness, which is amazing. So it's a real privilege for us to be part of the medical team that helps them get well.
Yeah, I love getting educated from you and your hygienists. I always tell patients that just going in for a cleaning, you're going to get an amazing education and realize why everyone should be choosing you for a holistic biological dentist. And you just can't emphasize enough how much that impacts somebody's overall health.
It's
And
unbelievable. I'm telling you, we have patients that don't know that they had open heart surgery and had endocarditis because their gums were infected. It's like mind-boggling, something that can take 2 hours to clean that mess up, cause a permanent damage on somebody's heart. And that should never happen. That should be part of standard of care. That should be part of education, basic education in schools. And it's just not being done. People are not getting it. So we are very passionate daily educating people because You know, there's other things that you don't have any control, but your mouth is so simple.
Do you see any time in the near future holistic biological dentistry becoming part of the education in mainstream dental schools?
I would only pray that that would happen and it would happen quickly. Ali is encouraging me to put a biological dentistry course for general doctors to learn about it. Because as I learned about it 24 years ago, and it's been a journey of more information and now becoming more of a health expert, because I see the connection for 24 years and I'm like already, oh, this is related to that. So we're working on putting a course together to open the eyes, of the people that don't have this knowledge, because it makes me sad, that a lot of my colleagues are developing neurological conditions because they're removing mercury without protecting themselves or the patient. And they have Parkinson and they have ALS and they have neurological things, anxiety, all these things. And when I hire, people that are practicing for 20, 30 years, and they're not knowledgeable about this, and I try to train them, they already have medical conditions that are visible to me that are related to the toxicity that they have been exposed, and they don't even know that that's the case.
That there's a correlation there?
Yeah. So, I embrace them. I talk to them. I ask them to watch videos, and then they put two and two together. One of the doctors that I hired, he had tremors and he was trying to hide it from me. And then I went and he was doing a case. And then when he was done, I said, "Doctor, are you aware that you have tremors on your hands?" And he said, "What do you mean?" I said, "You need to start doing detoxification of heavy metals because you already have a neurological condition." And then, they are, one of them decided to, instead of being a dentist, he became an anesthesiologist, for dental procedures. So he's no longer able to practice because of the shakes, but he's in the field, but, not being exposed to things directly. So, I go to many dental meetings and I see my colleagues, 300, 400, 500. You can see as they walk and they speak, you see how the profession has impacted them, and they're not aware. They're not aware, or they don't want to open up their minds. I'm thinking about a particular dentist I know for 30 something years, and he has mercury fillings in his mouth. And he has them and he hasn't removed them, and he's close-minded, and his father died from MS. So it's like the father has said to us, I believe that I got MS because I have mercury fillings. I saw it on 60 Minutes. I saw it on 2020. We're talking about 1987. We were told by a friend of ours that he got MS from that. And we were like, we ignored the whole thing. We did not watch the show. We did not look into it. Why? Because we are doctors. We never heard of that. So, it was only when I came to Florida that I went to a oral medicine and toxicology meeting. It's an international meeting of scientists, toxicologists, microbiologists, biochemists. They were speaking about the mercury toxicity. And it's like, my background is in chemistry. I know mercury is toxic, but it cannot be what I'm putting on patient's mouth. They were like, yeah, what you're putting on patient's mouth, 50% is mercury and is poisonous. How can I be taught in dental school that can be okay? Right?
It's mind-blowing.
So I go back to my dental materials book. I'm like, that has to be there. Sure enough, it was there. It was there in one sentence on one thick book, but I never remember even reading it, because you have so many classes, you have 10 classes at a time plus clinical work, and you just want to pass the exam for the dental materials. It was there. It was in the books of dental materials, mercury being toxic and being part of the materials. So sometimes, we get overwhelmed by all the information that is in front of us. And I have been guilty of that. But once I learned that mercury is a neurotoxin, I could no longer blame my lack of knowledge to my school. Then it's my responsibility as a professional to investigate everything I do, every procedure, every material, and then present responsibly to my patients. This is what is available to you. This is what's available to me. Now, the big news is titanium implants are being found in different organs. So I put titanium implants for 20 years, right? Not a lot of them, but enough.
Material.
Guess what? Now they're correlating the neurological problems to that. Somebody that has Parkinson or ALS, they have to remove the titanium, or MS, they have to remove the titanium implants. I had a patient that came from 5 hours away. He said, Dr. Cintron, the doctor doesn't want to take the metal implants. And I cannot be in the computer. Every time I go, I start shaking since he put the titanium implants. I said, I will take them out for you. Guess what? The patient now has a better opportunity to treat his MS. He went to San Francisco. He got stem cells, inhale into the optic nerve. The optic nerve is connected to the area on the brain that affects the neurotransmitters. He got that stem cells into the nostrils, into the optic nerve, right? It goes into the optic nerve because the nose is connected to the optic nerve. It went to the area of the brain that is related to MS and Parkinson. He came without a cane to visit me because he wanted me to know that he's thankful that he has a chance. I got all the metals out of his mouth. He went to get treatment. He still has MS, but he is doing a whole protocol of amino acids and different things every day to keep everything under control. But he's not taking the meds, those crazy meds that they give the patients. So there's always a way to do things better. So now we stop doing titanium implants. But the patients, now they are educated. Titanium implants are not the best option. Sometimes you might just go with a bridge or with a partial. Or my grandmothers didn't have teeth, right? They had dentures, they had them in a drawer. They were in the 80s, 89, 88. They were fine. They were healthy as healthy can be. They lost their teeth due to periodontal disease. Or every pregnancy, they had 9 kids each. They lost the teeth because, the calcium, the baby takes the calcium, and you have to, there's a lot of things you can do now to reinforce your teeth, but not, they were born in like the 1800s, 1895, they didn't have advancements. So, people live without teeth into their 80s and 90s.
It's not preferable though, right? You can
Terrible.
Prevention. You do it, you need to live without an infection.
Yeah, but it's better not to have a tooth that's infected,
right.
Than to have a tooth. I'm a cosmetic dentist, so I'll give you teeth, don't worry. But you have choices, and sometimes you have to choose something that is healthier, and then be aware. But a lot of people don't care. They just want to do what people see. Oh, forget about the mercury on the back. Just do the ones people see. And then you see that they have heart trouble, they have, arrhythmias, tachycardias. I have people going into AFib that have mercury and metals in the mouth. You have to get it out because the mercury is going to affect the mitochondria, which, the mitochondria is in the nuclei of the cell. And then that's where the energy gets produced. But the mercury goes into the mitochondria and affects the functioning of the mitochondria, cannot produce the ATP. So all our cells are electrical. So when you have a metal that is a neurotoxin, it's going to make all your cells be out of whack electrically. So you're going to be like this instead of being like that. So, the mercury affects every cell in your body.
In your practice, do you use ozone injections?
We have ozone, we have lasers, we have all different modalities to treat the patients, and we have developed different strategies according to their medical history, according to the level of infection. I don't treat all patients the same way. We develop protocols that I feel that would be beneficial to that person. With the experience of 34 years, you kind of like get a sense of what would be best for each person. So we develop protocols according to the patients. One of the ones that we like is the Huggins protocol. When we remove the mercury, always, or do surgeries, always have intravenous vitamin C on the patient, because it's an antioxidant and it's going to be drawing all the toxins. And it's wonderful because the patients come the next day, they don't have swelling, they don't have pain. They actually are more detoxified, not only physically, but at a cellular level with the antioxidants that we use. We have glutathione. We also use the plasma-rich growth factors. And that, even if you don't get an extraction, the plasma-rich growth factors, I can inject them in the mandible, in different areas, and it's going to boost the immune system. So we like to do that. And it's anti-aging. You can do it on the skin. We have the micropen that we can do and put the plasma on the skin. And it's rejuvenating. The plasma, there's life in the blood.
Absolutely.
So,
thank you.
Thank you so much. I hope that you enjoy the talk that we had, and I pray that many people are going to call Jenna and book, because obviously is the best non-invasive way of getting a baseline. I remember paying $5,000. I went to get a whole body scan, and I think it was an MRI or CT. I don't remember, but I paid $5,000. The patient told me, get your whole body scan and have a baseline. And it was like hours. And you can get a thermography for a fraction of that, not have the radiation or the exposure of whatever they put you through, and have a full idea of what your body has. I think it's a win-win. It's a really great thing to have accessibility. And I'm so happy you have somebody in Fort Lauderdale.
I agree.
Yes.
Yeah, I'll text you so you can book your appointment.
Yes, I will, and Ali will as well. Thank you so much, Shanna.
Okay, you're welcome. Have a wonderful day. Thank you.
God bless you.
You too. Bye-bye.
If you have any questions or suggestions for further future topics, please leave a comment below. Thank you.